So I've been asked, what do I do if I'm going to have a total knee replacement in a month? And that's a great question. I think that there's a lot you can do to help prepare for your surgery. One of the most important things is to learn the exercises that you're going to have to do right after the operation before you actually have the surgery. That way your body is familiar with them, it's going to be easier to learn, and it will help you to control pain and swelling after the operation. So for a total knee replacement, the single most important exercise I find is wakening up the quadricep. What you can do is you get a towel, you place it onto the bed or your bed where you're doing your exercise. And then what I want you to do is to slightly pull your ankle toes up towards your nose and your foot slightly out to the side. And then I want you to push your knee into the bed. So try to touch the towel. That's good. So you want to see the VMO actually contract and the heel lift up off the bed. So this contracts and lifts up. A lot of times people will try to do this and when the muscle's asleep, they'll actually use their butt muscle to push their leg down into the ground. Well, you can see that if the muscle isn't working properly, but if you contract that muscle and to push your leg out, then it doesn't do the trick, because the key is to get your kneecap gliding gently up and down. You don't want your kneecap to get encased in scar tissue, which can happen after the operation. So you're going to ice, you're going to learn this exercise from your physiotherapist, and start doing it in recovery room if you can. Of course, you should get permission from your specific surgeon to go ahead with this exercise. But in my experience, what I've found is that if you can waken up the VMO, you get less swelling. If you get less swelling, you have less pain. If you have less pain and swelling, the range of motion will come very naturally to the joint. The other thing I'd like you to do is work on exercises for the rest of your body. Remember the crossover effect. Doing an exercise for the opposite leg will help your post-operative leg strengthen. And you can do exercises for your hips, for your core, to work on your balance so that you're not overstressing the new knee. And good luck.